So faces by Kusuma, or the face doctor of South Florida, are some terms that I'm hearing from patients and others, because we do a lot of face surgery, facial rejuvenation surgery. So keeping that in mind, I Thursday morning I have my consult days today, and I saw a mother and daughter this morning who are from Puerto Rico, I think, as they say in South Florida. Living in South Florida, you see people from all over the world, which is a wonderful thing to see, because patients of all ethnic backgrounds make up South Florida, which is another wonderful thing to practice here. And people come from the Caribbean, people come from South America, people come from Canada, and it's a destination place. So I got a chance to see a couple of darker skin tone patients from Puerto Rico this morning, mother and daughter. The mother came for face, and the daughter came for her breast work. But today, I want to specifically talk about darker skin tones and facial rejuvenation surgery for darker skin tones. A lot of times you don't see that very much, anywhere, because most of it is, whiter skin, most commonly. But I want to share this with you. So if you look at this patient, she has skin tone like mine. Skin is generally, for purposes of medical treatments, classified in classes 1 through 6, our types 1 through 6. Type 1 is the fairest of the fairest skin. Type 6 is the opposite of that, darker skin. And everything in between is like, type 2, type 3, type 4, type 5, and type 6. Mine could be classified 4.5, 5-ish, maybe somewhere in the neighborhood. This patient is also in that same category, because my skin tone is probably very similar to hers. So if you look at this patient, she wanted all of this excess in the neck to be improved, because it made her look full and heavy. Her face looked heavy, her eyes looked heavy. And when you look at the patient like this with darker skin tones, there's of course a fear, right? So how is the incision going to heal? Are they going to form keloids? Are they going to look dark? If it's on the face and the eyes, is it going to be a problem? One of the things about scars is that scars heal differently in different parts of the body. On the eyelids especially, the skin is extraordinarily thin as compared to the abdomen or the legs or wherever, rest of the body. However, on the eyelids is extraordinarily thin skin, and there's not a lot of tissue material to form thick, bad scars for the most part. So on this patient, I did an upper eyelid blepharoplasty where the eyes opened up some more, and you can see hardly any scar already. It's been about 3-4 months in surgery. So safe surgery in darker skin tones to do eyelid surgery. And if you look at her neck, you can see all of that extra skin is gone. Now you have a separation of neck and the face and the rest of the chest. Here, it looks like it's one continuous neck and the face kind of blend together. There's no separation or definition. And the face definitely looks slimmer and narrower. The neck looks slimmer and narrower. The chin looks slimmer and narrower. So if you were to look at this patient today on the road, you would never think she had any surgery at all. And the scars have healed beautifully. As you can see, very little to nothing there. And so, surgery for the face, when it's necessary, can be done in darker skin tones very safely as well. Of course, you have to do a detailed family history of keloid formation. You may want to do a test run of some type if you feel worried about it, to see how they would heal. But generally speaking, I have a decent amount of experience, of taking care of darker skin tones, because I'm dark skinned myself, and people come to me because I have some relevance and some expertise and some knowledge and personal lived experience with it. And so I take this task very seriously, to make sure that I perform responsible, safe surgery without causing any problems with scarring in darker skin tones. And on top of that, because I take care of darker skin tones, in addition to taking care of the normal, straightforward, lighter skin tones, I do a lot of skincare for that as well. And so we have a great new laser system called Clear Ultra Clear that is wonderful for darker skin tones, that I've used it on myself, which is very helpful. In these type of patients, you can also use fillers like RHA, which is also wonderful to use. So we have many tools that I use, including the art facial that I designed for improvement of skin, of darker skin tones and lighter skin tones as well. So it's a comprehensive approach to skin management. It's a comprehensive approach to all kinds of variations of ethnic groups to manage these type of surgeries, because if you're a face doctor of South Florida or Faces by Kusuma, you have to be good at all things faces for everybody, all the way from a Swedish type of skin all the way down to African type of skin and everything in between, Indian skin, Chinese skin, Japanese skin, and Mediterranean skin type. So I love this type of work in facial surgery. So I just want to share with you a very good recent example of somebody with darker skin tones to undergo facial surgery for the neck, for the face, for the jowls, for the eyes without any complications whatsoever. Soon I'm going to be posting some examples of skincare that is going to show you how safely skincare can be done from 20s 30s on for all skin types. So I'm excited about that. So if any of you are interested in having facial rejuvenation surgery for dark skin tones, come see us. Thank you.